Chapter 15 is on different types of therapies, which are treatment methods aimed at making people feel better and function more effectively. The two main types of therapy are psychotherapy, which typically involves group work or individual work with a therapist to discuss concerns or problems, and biomedical therapy, which is the using of different types of medical procedures or drugs to change a person's behavior. Person-centered therapy is one of the most common humanistic theory styles, and it was developed by Carl Rogers. And it is where the person is the main focus of the process and where the therapist is attempting to understand their experience. This process has three key elements. The first one is authenticity, which is genuine, open, and honest responses to the individual by the therapist. The second one is unconditional positive regard, which is warm and accepting behavior and completely being uncritical and non-judgmental towards the person. And the last one is empathy, where the therapist tries to see things from their client's perspective and also tries to get an understanding and feel how they feel. Here is a dramatization on what person-centered therapy might look like. I guess what I'm trying to say is that being home all the time can be really difficult, and adjusting to this new normal, it's exhausting.
How's that?
You just can't go out and do the things that you're used to doing all the time. And it's the exhausting part is finding ways to stay happy inside.
Tell me about it. About a time you remember being happy, carefree.
I guess that would have to be before all of this started and being able to go out and hang out with friends and just have a good time. So it's times like these that you feel pretty helpless.
There is a saying that goes something like, Lord, grant me the strength to change the things I can, the courage to accept the things I can't, and the wisdom to know the difference.
That does make a lot of sense, and I guess I wish I'd known that sooner.
So, let's talk about your parents.
My parents, but do you think that they have something to do with the way I feel?
No, but I'm a psychiatrist, so I have to ask you about them at some point.
Meet Emily, quarantine partner and life partner, and we're going to talk a little bit about her experience taking antidepressants. What type of medication are you taking?
I have a prescription for Prozac, which is an SSRI. It's a selective serotonin reuptake inhibitor, which means that it helps me produce serotonin because naturally I do not produce enough on my own.
How long have you been taking the Prozac?
I've been taking Prozac since December of 2019, so that's 6 months now.
Do you find that this medication has helped you in treating some of your symptoms?
I think it's definitely helped with treating some of my symptoms. I also think it's important to note that antidepressants aren't a cure for depression. It's just another tool for you to use. So like when I initially started therapy, I was kind of in like such a terrible place that I couldn't even really talk about the issues that I had. So once I started the medication and my body kind of acclimated to it, I was in a place that was okay enough for me to actually work on issues.
Have there been lapses in taking your medication, and can you describe a little bit about what that was like?
Yes. Occasionally I'll miss a day or two of my medication, sometimes 2 days in a row. Typically, if I only miss one day, I don't really notice any significant changes, but once I miss 2 or more days in a row, I can definitely feel, I guess it's sort of like going through some sort of withdrawal. I generally feel like overall uneasy, irritable, very moody, um, cranky, kind of just like a bad attitude, and you can really feel yourself kind of start to go to like a place that you don't want to be in.
Who prescribed you the medication?
I see a therapist, and she recommended that I go on to a medication. But because she's not a psychiatrist, I then had to find a psychiatrist, because a doctor has to prescribe this kind of medication. It's recommended that you don't see a general physician just because you typically have to play around with dosage and oftentimes which prescription you're given. So it's better that you go to a psychiatrist, someone whose actual job it is to deal with these kinds of drugs.
Do you feel the use of the antidepressant is more long-term, or would you like to eventually wean off of it while also working with your psychiatrist and slowly lowering the doses over time?
I think that this would definitely be a long-term solution for me. I'm sure it's not the same for everyone, and there are probably a lot of people who wouldn't want to be on it forever. But for me, it's just been such a night and day difference in how I feel that I would be worried that if I even weaned myself off of it, that there would just be super negative effects.
Well, thank you. So, exposure therapy is a type of behavior therapy that introduces the person to situations that are related to their anxieties and fears, and it is only done under a careful, controlled condition with a psychiatrist or with your therapist. One type of exposure therapy, which can sometimes be seen as controversial, is called EMDR. EMDR stands for Eye Movement Desensitization and Reprocessing, and it's used to treat things like depression, anxiety, trauma, PTSD, just to name a few. The next video is actually a recording of my own therapy session in which I use EMDR, just to give you a little insight on what it actually looks like and how it works. EMDR has a direct effect on the way the brain processes information, releasing emotional experiences trapped inside the nervous system. A trained therapist in EMDR will use bilateral stimulation, so something that occurs in a moving side-to-side pattern, such as moving your eyes back and forth, which can be seen in this little clip here. There's also tapping, which can be seen in this clip, which is another form of bilateral stimulation, alternating from left to right, which activates the brain's two hemispheres. And it serves to strengthen and integrate the emotional response so that it becomes more easily available. EMDR is based on the idea that negative thoughts, feelings, and behaviors are the result of unprocessed memories. The disturbing memories are reprocessed by the brain, resulting in painful feelings being exchanged for resolved and more peaceful feelings. EMDR sessions are always paired with a type of psychotherapy to allow the person to discuss and understand what they're reprocessing, and so that a therapist can monitor and ensure that this type of therapy is still safe for the person to continue. In my personal experience, EMDR is frightening, emotional, raw, exciting, scary, all these emotions mixed up at once. And while I can understand how this method can be controversial because of how intense it is, for me it has been the most effective method in reprocessing past trauma, and it is something that I am forever grateful for. If you're going through a difficult time, it is important to learn ways to take care of yourself and to find an option that works best for you, because everybody's different. There are still a lot of therapy options available even during this pandemic, and you can find those options by reaching out to your medical provider or to friends and family for different recommendations. And if therapy maybe isn't for you, you can still be practicing self-care and learning ways to stay happy and motivated throughout this time. So take care, everyone.